Hi, my name's Chris. I'm a critical care paramedic. For those of you that don't know what that is, it means simply that I go to the most sickest patients on the side of the road, those involved in big car crashes. For a day job, I work on the air ambulance and I volunteer for NARS, which means that I give up my spare time to do pretty much the same job I do on the air ambulance, but on a car or on a van. NARS stands for Norfolk Accident Rescue Service. It's a charity. And what we do is we provide highly trained doctors and critical care paramedics. We equip them with the most up-to-date medical equipment and drugs, and they go to the most critically ill patients at home and at the side of the road.
So behind us we've got our VW critical care vehicle. We take that and all of this kit that fits inside it out to our patients. So here we've got our Lucas device that we use for cardiac compressions, we've got our defibrillator, we've got oxygen, suction and our ventilator. So I'm going to check it all now, make sure there's everything that we need, pack it away neatly, and then I'll be signing on ready to respond to our most critically ill and injured patients.
The equipment that we have is like bringing an intensive care unit to the side of the road. We've got a professional ambulance service that manages the majority of patients really well. But there are patients who are involved in serious car accidents or cardiac arrests that need this level of care because currently it just doesn't exist out there all of the time. We've been called for a crew request by one of the ambulance paramedics. I think this is an elderly patient who's got an orthopaedic fracture, a fracture to the leg, and they just need some more pain relief to straighten it out. So NARS provides doctors who have an awful lot of experience in emergency medicine and anaesthetics. We give them blue lights, they've got a car, they've got all the equipment they need, which means if there's an accident down the bottom of the road or even miles away, they can get there quickly. It seems like a no-brainer, but it would be a shame not to utilise the skills that we have in the community. We've got hospital doctors that could live at the end of your road. We've now given them the ability to respond to the most critically ill patients in your community. We need the support of you so we can provide drugs and equipment to those advanced doctors and critical care paramedics to keep this service going. Because you never know when it's you that's injured on the side of the road or even your family. So if you can just give a little bit for us, then we can continue this vital service.